The World Health Organization has been at the center of attention as it tries to lead the battle against the Covid-19 pandemic. The UN agency is the world's primary public health body and is designed to respond to global health challenges. But Covid-19 has tested the WHO to its limits.
Had the WHO done its job to get medical experts into China to objectively assess the situation on the ground?
With accusations that it has been too soft on China, where the virus is thought to have originated, threats from US President Donald Trump to cut funding and leave, and urgent requests for reform from major donor countries in Europe. So what is the WHO? The World Health Organization is a specialized agency of the United Nations devoted to international public health. Its headquarters are in Geneva, and more than 7,000 people work in 150 country offices, as well as 6 regional offices. What's the history of the WHO? As World War II was coming to an end, countries came together to form the United Nations. They voted to create a global health agency with the objective of the attainment by all peoples of the highest possible level of health. The WHO officially came into existence on the 7th of April 1948, the day we celebrate today as World Health Day. The WHO started with just 55 member states, but has now grown to include 194 member states. What does the WHO do? The World Health Organization tends to attract people's attention when it declares an international health emergency. That was the case in 2009 because of swine flu, in 2014 and 2019 because of the Ebola virus, and at the beginning of 2020 because of the Covid-19 pandemic. But the WHO doesn't just respond to disease outbreaks. It is active in promoting and improving health worldwide. It can support governments in vaccination campaigns, for example, or provide expert advice on water and sanitation. The WHO's constitution says its mission is to act as the directing and coordinating authority on international health work. Basically, to establish global standards and give advice to countries on rational public health measures. The WHO also provides guidelines on the medicines and diagnostics that should be used in relation to a specific disease, taking into account the resources available. Who runs the WHO and who pays for it? The WHO is governed by its member states. This means that it does not have legal authority to enter countries without permission, or to force countries to take its advice. What the WHO can do is persuade through science, evidence, and by showcasing examples of good practice. The WHO's programme budget for 2020 to 2021 was $4.8 billion. About 1/5 of this budget is made up of the compulsory contributions of the current 194 member states. It is redefined every 2 years. But not every country pays the same, as the amount of the contribution is determined by the respective ability to pay. The remainder and largest part of the budget is made up of voluntary contributions from member states and donations from foundations, UN institutions, NGOs, and private individuals. What are the WHO's main achievements? Some of the WHO's most praised achievements include its child vaccination programs against diseases such as measles and polio. Polio infections have dropped by 99% in recent years, and the disease is now endemic in just 2 countries, Afghanistan and Pakistan. The WHO also achieved a major success in 1979 when it declared the global elimination of smallpox. It was the first disease in history to be eliminated by human effort. Other diseases to which the WHO is particularly committed are AIDS, tuberculosis, malaria, and tropical diseases. However, the organisation also focuses on non-infectious diseases, from heart disease to diabetes, from cancer to mental disorders, which together account for 70% of deaths worldwide. The Covid-19 pandemic, a case study on how the WHO works. In the case of communicable diseases such as AIDS, malaria or Covid-19, the WHO tries to coordinate international activities. These include cooperation in research and the development of tests, drugs and vaccines. The WHO also tries to ensure equitable access to treatments. For Covid-19, for example, it has set up a mechanism designed to ensure low-income countries get vaccines at prices they can afford. A public health emergency of international concern, such as the one declared at the end of January 2020 because of Covid-19, is the WHO's ultimate alarm bell. Declaring an emergency releases financial and technical resources. The WHO issues concrete recommendations for action to be taken by the member states, such as quarantine measures or travel restrictions. However, they are only recommendations. Member states are not legally bound to follow them. An emergency committee consisting of health experts, virologists and other scientists monitors the emergency and adapts the recommendations as the situation develops. In February 2020, the WHO sent international experts to China on a mission that was agreed to by both parties. Together with Chinese researchers, they looked into the steps the country was taking to prevent and control the spread of Covid-19. In early March 2020, the WHO officially declared the spread of coronavirus to be a pandemic.
I'm declaring a public health emergency of international concern.
In doing so, it recognised that infection with the new coronavirus, SARS-CoV-2, had reached global proportions. The WHO sent more than 70 teams of response coordinators, epidemiologists and other advisors into countries to help guide Covid-19 response. It also raised money for and organised a global Covid-19 supply chain to get diagnostic tests, medical equipment and aid workers to places that needed them. And it helped to organise global research into treatment, drugs and potential coronavirus vaccines. What are the challenges ahead? The Covid-19 pandemic is by far the most devastating global health threat in the WHO's history. The WHO has devoted hundreds of millions of dollars and an all-hands-on-deck approach to the effort to vanquish the virus. Even so, the agency has been accused of failing to uphold its mission. The United States was the loudest critic, with President Trump accusing the WHO of being too close to China. The US temporarily pulled out of the WHO and cut its budget. The United States is the WHO's largest donor, providing about 15% of its budget. European countries publicly defended the WHO. But behind the scenes, many are also concerned about the relationship with China. It seemed odd that Beijing waited almost a year from the start of the health emergency to allow a WHO team into Wuhan to investigate the origins of the virus. Germany and France are known to be working on proposals for WHO reform. The other challenges the WHO faces. In addition to increased scrutiny over its role in the coronavirus crisis, many detractors have slammed the WHO's coordinated responses to other disease outbreaks as being slow and poorly coordinated. That includes the 2014 Ebola outbreak. It waited 5 months before declaring a public health emergency of international concern, despite pleas from groups such as Doctors Without Borders. Over the past decade, the WHO has become increasingly reliant on voluntary contributions. Some feel this puts pressure on the organisation to align its goals with those of its donors. In response to these criticisms, the WHO has instituted several reforms. These include a new incident management system, the creation of a reserve force of public health workers, a $100 million emergency fund, and measures that would require staff to rotate among posts around the world. Some critics describe these changes as merely cosmetic. In addition, there have been political challenges. The US regularly refuses to fund WHO projects which advise on reproductive rights and sexual health. In 2018, former US President Trump threatened to cut US contributions if other member states proceeded with a resolution encouraging breastfeeding. The future. The WHO has played an irreplaceable role in global outbreak response. But it is also clear the Covid-19 pandemic will lead to more examination of how the WHO works and probably to reforms. In general, the question that looms over the WHO is this: will global health collaboration emerge unscathed from the Covid-19 crisis? The WHO is at a fork in the road between multilateralism and solidarity on the one side and protectionism on the other, while sovereign nations reserve the right to protect their own populations.